So in this video, we will talk about the acute low back pain pamphlet. So Moshe, what is acute low back pain?
Well, acute in any medical problem means the length of time that passes since the problem starts. So when we're talking about acute back pain, is back pain that lasts for about a week. When we are going to a longer period of time, we're talking about what we call subacute, or if it lasts for more than 2 months, we're talking about chronic.
Okay, so acute back pain, so what are the symptoms? What do you feel?
Let's say just for a scenario that is very logical, and maybe some of you had it before, you bend to lift a heavy box,
right,
or what we call the weekend warrior. You're usually not active, and then your wife, for example, asks you to move all the living room from one side to the other side, and then you bend to lift something and you feel sharp pain in your low back. That's what we call the acute phase.
Right.
Now, in the acute phase, as you all know, there is the first stage of it is inflammation. That's an inflammatory response of the body. Our body already tried to fix the damage. Usually, maybe you'll talk a bit about the symptoms in the first few days.
So you can't move, very hard moving, a lot of pain, and most of the time you can't even go to work. You're completely stuck. So what should you do? Like Moshe just said, this is the inflammatory stage. So the doctor probably gave you some anti-inflammatories, which you could take within this first week. What else we could do?
Well, in the first stage, our goal, and it's very important, it's also written in the pamphlet, as I'm sure our viewer watched the pamphlet already. The first few days, the first couple of days, it's advisable to take some rest, take it more easy, stay in bed if needed. But it's very important, and a lot of patients don't do this transition after 2-3 days, to start and get off of bed. Start to walk a bit, walk every hour. Try to find positions that are not aggravating the pain. Actually staying in bed longer than advisable is something that can extend significantly the period of pain. We can also use some orthopedic aids in this stage to help us. For example, many patients have pain when they are sitting. When they are sitting, their pain, I'm sure you saw it with your patient. As they are sitting, not all of us sit like this or sit in a good way. A lot of them sit like this, and that's extend their pain significantly. Now, one small and wonderful thing that I'm using with a lot of my patients is this lumbar roll. Maybe you can talk about it a bit.
So lumbar roll is very simple, cylindric cushion, has a belt, ties around the chair, and if Moshe, you could turn this way. So if Moshe was sitting on a chair, you would put it right at the low back, right at this the belt line, tie it around your back, and make sure the back is completely against the chair. You would place the cushion, and that would maintain the spine in a what we call neutral extended position. Okay. Another item, Moshe, what do you suggest?
Another item that I find very effective for the first few days, again, and sometimes even for longer, is the back belt. This is a very good one, which I always recommend you to buy good products, because eventually they're worth the money big time. That's a belt that goes around the waist, and I can maybe demonstrate it myself. Hopefully I didn't gain too much weight. I can try on you. You just lost some weight, so it will be good. Okay. So that goes
this, and we have some straps to hold, support your back. Now, should you wear this all the time, every day?
In the first few days, I wouldn't wear it at night, but I would wear it whenever I have pain. Then gradually, I will try to decrease the use of it. As I suggest with every orthopedic device, use it only if it's really reducing your pain. For example, if you have this pillow and when you sit with it you feel more pain, which can happen, then don't use it. Okay, that's just using some common sense. Now, about the belt, I recommend to use it in the first few days as needed, and then start gradually decrease the usage of it. One other thing is to find positions that are reducing your pain. For example, try to find out what makes your pain better. Is lying on the stomach is better than lying on the back? Is sitting better, walking better, then walk every hour? I know it's a very scary, it's a dreadful subject, everyone is afraid of it, doctor, therapist, patient, but honestly, most of the back pains are something that will get better in a few days. If after a week you don't feel it's significantly better, I would definitely recommend to suggest to find a physiotherapist. And if I may suggest, someone that is specialized in the McKenzie method.
Right, and that's one of the techniques the physiotherapist would use, is the McKenzie method, which is I think the most recognized and proven technique out there to treat low back pain, acute, chronic, or subacute, obviously. So 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 you should wait a week and then seek
Yeah,
professional help?
try to wait for a few days. Don't rush into the hospital.
Right.
But we have some cases that we do want to see a doctor as soon as possible. And in these cases, I will go, for example, for if you have low back pain that comes together with a leg pain or numbness or tingling that radiate down your leg, especially if it's tingling below the knee.
Yes.
You can talk maybe about other things that we should be worried about.
Any urinary incontinence. You can't control the urine coming out. That's definitely an emergency. You should go to the ER. Any pins and needles, numbness, or weird feelings in the saddle area, that's also a big sign that you should go seek professional advice. And of course, if you're in doubt, you consult. You consult. But in general, if it's low back pain, debilitating low back pain, nothing below the waist, and wait it out, rest, anti-inflammatories, like we said, orthopedic aids, and you could obviously call and consult a physiotherapist or your doctor.
So one more thing is in our video section in this YouTube or in our Facebook page, there are some exercises to try and help immediately to relieve a back pain. So you can also consult this video, try it out for a day or two. If you feel it doesn't work, then come and consult with us. Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.